this is Mark Adajar from XSculpt in Chicago, wanting to talk to you about treatment options for gynecomastia. Gynecomastia is one of the surgeries that we love to do the most. There are different ways to take care of gynecomastia, and that's kind of the topic of today's video. Now, it depends really what the cause of gynecomastia is where the treatment is directed at. Now, the most common causes of gynecomastia is idiopathic or spontaneous, where it's just bad luck and you're born with it, or you just have it and there's no reason why you have it. Now, in those cases, the treatment is surgical because there's no underlying cause to treat. So we can do surgery for that, which I'll go over in a second. Now, if it's due to other reasons, then we take care of those causes. For example, if it's due to steroid use, then stopping steroid use will usually cause a decrease in the gynecomastia. Or if you're on testosterone replacement therapy, then there are certain medications we can give that will basically block the effect of estrogen. There's a medication which I like to use called tamoxifen, which blocks the estrogen receptor at the level of the tissue and preventing the tissue to be activated by the circulating estrogen. And there's a medication called Arimidex, which basically stops your body from making making estrogen. And so either one or the other, or a combination of the both, in most cases, can help treat gynecomastia in issues with steroid use. Pseudo-gynecomastia caused by obesity. A lot of times when you follow a good diet and exercise plan and get your body fat percentage very low, that can take care of a lot of the symptoms people suffer from gynecomastia. And so basically weight loss and exercise, if it's due to pseudo-gynecomastia, can take care of it. If your gynecomastia is caused by excessive marijuana use, then you would cut back on the marijuana to bring down the amount of gynecomastia. However, it should be said that even though with some of these measures, the gynecomastia may not completely go away. So, basically, again, to treat it is treat the underlying cause, but in most cases it's idiopathic, and so surgery would be the option. Now, when we do surgery for gynecomastia, it's a two-part procedure done at the same time. Basically, it's what we like to do at XSculpt is what we call smart lipo. Is we laser all the fat tissue and basically melt it to allow for us to get as much as the fat out as possible, and whatever fat is not liposuctioned out, then your body will excrete over time. The laser that we also use can help with skin tightening, to shrink down the skin. That will allow a better cosmetic result. So we start out with the laser, and then we follow the laser immediately with liposuction and suck out as much as we can. After that part is done, we have to remove that gland, because if we don't remove that gland, then you can still have very puffy nipples. It won't be cosmetically pleasing. The skin won't sit right on the chest. So that usually involves an incision at the border of the areola, or the border of the nipple, so we can pull out that nodule or that mass that sits right behind the nipple, and then we close it up with stitches that dissolve. So that is, that's the basics of the surgery, the very basics of the surgery regarding gynecomastia. We do have a video on our channel on an actual procedure, so you can watch that. And I'm sure there are hundreds of videos on the surgery that go into deeper discussion on YouTube, which you can feel free to look up. So if you have any questions, please write it in the comment section below, and we'll get back to you as soon as possible. We'd love to see you in our office if you're in the area. Give us a call, and hopefully we see you soon to help you treat your gynecomastia, whatever the cause. Okay, thank you very much. Have a wonderful day.